Welcome to the Deep Dive. We're here to unpack complex topics and, well, give you the insight you need.
Glad to be here.
Today, we're tackling something quite striking in Japan's economy. It's this paradox around drug discovery.
It really is surprising, yeah. Japan's actually one of only a handful of countries with, the scientific foundation to do the whole pharma R&D process domestically. The basic science is strong.
Definitely. But then you look at the commercial side, and well, the engine just isn't there in the same way. We saw some figures from 2022, and they're, frankly, shocking.
What did they show?
Okay, so Japanese university startups in this space, about 363, which, sounds respectable as maybe a third of the U.S. total. But, and this is the crucial part, the investment flowing into those startups, it's only 1/100th, like 11/100th of what U.S. ventures get.
100? That's not just lagging, that's a chasm.
Exactly, a commercialization chasm.
So it's really about the scale-up capital. It seems brilliant research is just getting stuck in the lab. The ecosystem needed to take it forward, it just isn't there at the scale required.
Right. And the government, they recognize this. They're launching a pretty massive new initiative called the Advanced Drug Discovery Organization, ADN in Japanese. So our mission for this deep dive is pretty clear. First, understand what this new organization is supposed to do. Then, crucially, dig into the flaws experts are already pointing out.
And maybe most importantly, explore the alternatives they're suggesting. Because, let's be honest, the track record for these big government funding schemes isn't always great, is it?
Not always, no. Wasting public money is a real risk if the setup is wrong.
We really need to look at this through a lens of, economic rationality, not just political window dressing.
Absolutely. Okay, let's start with the government's proposed fix. How is this new organization actually structured? What's the plan?
Well, the first thing that jumps out is where it sits. It's being set up under the direct control of the Cabinet Office.
The Cabinet Office, not, say, the Ministry of Health or Ministry of Economy.
Exactly. And the general thinking, reading between the lines in our sources, is that this is strategic. It's likely an attempt to sidestep the usual bureaucratic battles, the friction you always get between MHLW, which oversees health, and MITI, which handles industry and trade.
Ah, okay. So an attempt to cut through the red tape right from the start. That sounds ambitious.
It is. And the way they plan to inject money is also quite aggressive. The main mechanism is this co-investment scheme.
Co-investment, how's that work?
Basically, if a certified venture capital firm, a VC, invests a certain amount into a startup, this new organization fund will then put in twice that amount.
Wait, twice? A 2-to-1 leverage?
Yep. 2 public dollars for every 1 private dollar from the VC.
Wow. That's a massive incentive. It really lowers the risk for the VCs in those early stages, doesn't it?
Hugely. And on top of that, they've also built in a way for the organization to invest directly. This is meant for those super high-risk, maybe very early-stage projects that even the VCs, despite the incentive, might still pass on.
Okay, so a two-pronged funding approach.
Right. And the other key piece is expertise. The plan is to bring in, quote-unquote, world-class authorities and experienced drug discovery people.
To do what, exactly?
To handle the project selection, make those critical go or no-go decisions along the way, and actually provide hands-on support and guidance to the startups.
Funding plus expert oversight. Okay, on paper, you can see the logic. It sounds pretty robust.
It does.
But this is where the critiques come in. And given that huge 2.1 leverage, choosing the right VC seems absolutely critical. What are the sources saying about how these VCs are being selected?
Yeah, this is flaw number 1, and it's a big one. Apparently, there are already over 30 VCs certified. But the criticism is that many of them, they lack actual demonstrated experience investing in Japanese drug discovery ventures.
But they're certified, huh?
The current standards seem to accept overseas investment experience. But, the critics are asking a really sharp question here. Does this just mean VCs who tagged along with bigger foreign investors?
Like piggybacking.
Rather
than leading the investment and showing they have the unique skills needed for this market.
Precisely. Are they certifying VCs who know how to navigate the specific hurdles here in Japan? Or are they just certifying based on a perhaps superficial overseas track record?
So the public's money, that 2x match, could end up essentially paying for VCs to learn on the job in a market they don't fully understand.
That's the fear. The experts we're looking at argue that the real criteria should be proven: hands-on experience and early-stage support in this sector, track record of getting drugs through regulatory approval or achieving successful licensing deals. And importantly, the whole selection process needs to be transparent. Public criteria. which apparently it isn't right now.
Okay, lack of transparency, questionable criteria for VCs.
Yeah.
That's concerning. Now, what about those world-class experts they want to recruit? You need top dollar for top talent, especially in pharma.
Mm-hmm.
But you said this organization is under the cabinet office. What does that mean for salaries?
Well, that's flaw number 2. It creates an immediate, pretty fundamental problem. Being under the cabinet office almost certainly means they'll be stuck with standard civil service pay scales.
Right.
And those scales, they just can't compete with private sector pharma salaries or what top international VCs pay their partners. It makes it basically impossible to attract the truly top-tier global authorities they say they need.
So it's a catch-22. You design a system needing elite expertise to manage high-risk public funds.
But you structure it so you likely can't afford that elite expertise. You might get mid-level people or maybe retired experts, but not necessarily the cutting-edge talent making the big calls elsewhere.
And does that tie into the risk issue? If these experts aren't getting huge financial rewards tied to success like a VC partner would.
Exactly. That's another layer. Without that potential upside, that financial stake in the outcome, what's the logical reason for a government-paid expert to champion a really high-risk, potentially revolutionary but long-shot project, a project a VC might back because of the potential huge return?
There's less incentive to take the big swing if there's no personal reward for hitting a home run, only potential bureaucratic trouble if you strike out.
Precisely. It shifts the whole decision-making dynamic away from pure economic potential towards perhaps safer, more bureaucratic choices.
And that lack of personal financial stake, that skin in the game, as they say, that brings us to accountability, right? What happens when these investments inevitably fail? Because some will.
Yeah, and this is where the comparison with private VCs really highlights a weakness. Private VCs push hard, they get deeply involved, because if the company fails, they lose their own money or their fund's money.
Their reputation's on the line, too.
Absolutely. A government body just doesn't have that same direct risk-return pressure, which, the sources argue, leads to a much weaker system for reviewing failures, learning from them, and holding people accountable for losing public money.
I remember the sources making an interesting point about the difference between overseas VCs and Japanese VCs here, structurally.
Yeah, that was fascinating. The point was that many overseas VCs operate as partnerships. So a bad investment directly impacts the partner who championed it, their career, their future earnings.
Much more personal accountability.
Right, whereas many Japanese VCs are structured more like traditional corporations. Responsibility for a failed investment can become, well, a bit more diffuse, less tied to one specific individual.
So if you take that already more diffuse corporate accountability and then layer it onto a government bureaucracy,
accountability can effectively vanish. It becomes very hard to pinpoint who made the call and learn concrete lessons when things go wrong.
and when you consider that structural weakness, the fear of repeating past failures with big government funds, it becomes pretty chilling. We're not talking small sums here.
No, definitely not. The sources really hammer this point, this pattern of box building, just creating a new government organization and then just distributing money without the right incentives and oversight. It just doesn't work for building long-term industries.
What were some of those examples again?
Well, there's the infamous Japan Display, JDI, investment, something like 300 billion yen down the drain. The new Tokyo Bank failure, around 140 billion yen lost. And the ongoing saga of the Cool Japan organization.
Oh, right. Cool Japan.
Yeah, where reports suggest something like 40% of their investments are basically unrecoverable, just racking up losses year after year.
Wow. So the worry is this new advanced drug discovery organization, despite the good intentions, could just become another one of those if these structural flaws aren't addressed.
That's the core concern. It needs to be treated like a serious investment fund, driven by rational economics, not like a political subsidy program.
Okay, so we've covered the financial structure, the talent, the accountability issues. But the experts also pointed out some, fundamental misunderstandings within the bureaucracy about what these startups actually need.
Yeah, this is really insightful. Flaw number 4, let's call it. It's about infrastructure. The plan seems to operate on an assumption that Japan lacks domestic R&D support services.
You mean like CROs, the clinical research organizations that run trials, and CDMOs, the manufacturing development guys?
Exactly. The government seems to think there's a big gap there that needs filling nationally.
But is that true?
Well, the experts say no, not really. These services exist globally at a very high level. And the more experienced Japanese startups, they're already using them. They're contracting with CROs and CDMOs in the US and Europe, wherever the best expertise is.
So the problem isn't a lack of these services.
The problem is the capacity of these university-based startups to effectively manage these external global services.
So it's not about building more labs or factories in Japan necessarily.
It's about the business skills. The real deficit is the lack of internal project management expertise within the startups themselves. And critically, this came up repeatedly, the skills for English contract negotiation.
English contracts. Because all this international outsourcing runs on complex legal agreements in English.
Totally. And managing those projects across time zones, cultures, complex data packages, that requires a very specific skill set. So pouring money into building, say, a national CRO service kind of misses the real bottleneck. You need to invest in the people running the startups, give them the global business capabilities.
That's a huge point. The capability gap isn't in the science infrastructure, it's in the global business management infrastructure.
You got it. And that ties into another bureaucratic limit, which we saw paralleled in AMD, the Japan Agency for Medical Research and Development.
Right, you mentioned AMD earlier. How does its structure cause problems?
Well, AMD faces the exact same issue we discussed for the new organization, the civil service pay structure. They find it incredibly difficult to hire experienced mid-career pharma professionals because they just can't match private sector salaries.
So who ends up making the decisions there?
It often relies heavily on people transferred from other government agencies or on retired experts.
Okay, and what happens when these people, even if they have experience, enter that bureaucratic system?
Well, according to some internal accounts cited in the sources, it's tough. They find it institutionally very difficult to really challenge the status quo, to push for risky projects, to speak truth to bureaucratic power.
Is that where the silence is the job quote came from?
That's the one, a really stark phrase. It suggests a culture where rocking the boat is discouraged, leading to overly conservative, formal, risk-averse project evaluations.
Which is the exact opposite of what you need to fund breakthrough drug discovery.
Exactly. You're unlikely to get funding for a truly disruptive, high-risk, high-reward idea in that kind of environment.
Okay, so we've laid out a pretty comprehensive case for why just building this new box under the Cabinet Office as currently proposed is likely flawed. What are the alternatives? What should they be doing instead?
All right, proposal one from the experts is pretty straightforward. Consolidation. Don't create a whole new organization.
Scrap the idea.
Scrap the new box, yeah. Instead, take the planned budget and channel it through the existing AMD structure.
Through AMA. But we just talked about its limitations.
Right, but the idea is to add to AME's functions. Keep its current role in allocating research grants, but add this new capability. Managing investments alongside certified VCs, using that leverage model. You avoid creating redundant administration, use an existing framework, but reform how it invests.
Okay, use the existing plumbing, but change the water pressure and direction. Makes sense. How do we fix the VC certification part then? Ensure they're actually competent?
Proposal 2. Radically redesign the certification system. Make it performance-based and dynamic. First, maybe phase it in. Like, give newly certified VCs an initial investment cap, say 10 billion yen, to prove themselves.
Okay, a trial period.
Exactly. Then implement strict performance reviews every, say, 2 or 3 years. Evaluate them rigorously. How well did the startups they backed actually progress against their business plans?
And if they underperform?
Decertify them. Pull their ability to manage this public money. Certification shouldn't be a one-time rubber stamp. It needs to be an ongoing process you have to keep earning.
That introduces real teeth, real accountability for the VCs. What about accountability for the public funds themselves, even within AMD or whatever body manages it?
Proposal 3. Formalize accountability for every investment decision. Even though it's public money, treat it with institutional rigor.
Meaning what, specifically?
Mandatory public disclosure of investments. Mandatory thorough reviews when investments fail, not to point fingers, but to learn lessons. And clear documentation of who made the key decisions so there's traceability if significant losses occur.
So transparency and a clear learning loop. No more sweeping failures under the rug.
Exactly. The current system often lacks that institutional learning from failure.
Okay, and finally, proposal 4. This goes back to that critical bottleneck you identified, the global capability issue. Where should the investment focus there?
This might be the most crucial investment of all. The government should fund targeted training programs, develop a cadre of legal and business development professionals within or available to these startups who are experts in project management, and critically, English contract negotiation for dealing with global CROs and CDMOs.
So invest directly in the human capital needed to operate globally. It's not just funding the science. It's funding the ability to commercialize that science on the world stage.
Precisely. In today's pharma world, that ability to navigate complex, global, English-language contracts and manage international partners, that is a core competitive asset. It's potentially the difference between a perpetually funded research project and a venture that actually gets a product licensed or acquired internationally.
Right. That really brings it all together. So the synthesis here seems to be that, yes, boosting domestic drug discovery is vital for Japan. But the path forward isn't just throwing money via a new politically controlled organization.
No. It has to be a shift away from that subsidy mindset towards a model built on, well, hard-nosed economic rationality, proven professional expertise, and really strict incentive design. Reward performance, demand accountability, learn from failures.
Otherwise, you risk just repeating the costly mistakes of things like JDI or Cool Japan. The rational approach seems to be leverage existing structures like AMD, but reform them. Make VC certification rigorous and performance-based, and invest strategically in those critical global business skills.
That seems to be the consensus from the experts critiquing the current plan.
So for you listening, as this story unfolds because this organization is moving forward, maybe shift your focus a bit. Yes, the huge funding numbers grab headlines, but the analysis we've discussed today suggests the real make-or-break factor might be less about the money or even the raw science.
And more about those softer skills. Can these brilliant academic teams actually navigate the complex, globalized, English-dominated world of contracts and project management that defines modern pharma development?
That capability gap, bridging the lab bench to the global market, might just be the hidden key to unlocking Japan's potential. It's the difference between a domestic breakthrough and a truly global success story, something to keep a close eye on.